Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about insect bites. One of the things that commonly comes into our office is they have a new area of swelling and redness, and they're not sure exactly what it is. A lot of times it's really localized and in a small area. And there are multiple different types of insect bites that can present that way. The most common insect bite, of course, are mosquito bites, and most people know how to recognize those, although you can get a really red and inflamed area if you have some kind of an allergy to those type of bites. I've had individuals I've worked with where they get really swollen after an insect bite. You can get the really red, almost rash-like appearance from fire ant bites. There usually be multiple little areas all close together, and the extremities are very common for that, especially the legs and feet. Flea bites, where you'll get little red areas. Bed bugs, same type of appearance, usually though it'll be on the trunk, not down the legs and feet. Chiggers, although not as common in Utah, they actually can happen as well, and you'll get really dark red spots or dark red areas that can actually be happening there. Ticks, of course. Spider bites. There are multiple different types of spider bites. A lot of times you can have just a single puncture area or puncture wound area. You could also have an area of redness with a centralized, almost blister-like appearance, depending on the type of spider. If you have a brown recluse spider bite, however, it's going to be really swollen and red around it, and you'll get some more diffuse appearance, so it'll actually be a more spread out area of redness. Black widow bites will typically be red with a white area in the center and sometimes even a wound centrally. So depending on the type of bite, depending on the type of problems that you have, they can present a few different ways. Everything from a rash to a inflamed area to a almost like wound type area. It depends on the type of bite. You may get a localized area of redness in that area, and you may even get streaking. We kind of look for that, especially in the extremities. If you got a red area and you got a streaking going up the legs or going up the arms, then you're worried about an infection secondarily to that, and usually we start having them treated with, say, soaking warm water and Epsom salt. Sometimes with insect bites you may have to do an antibiotic. I've had a couple different patients where they got a pretty significant infection secondary to a spider bite. One was in the military, and he was out in the field and he got a pretty significant spider bite, and ultimately he had a MRSA type infection secondarily to that. So if you have an insect bite or you have a new area of redness and swelling, it could be evaluated to make sure to decide if it really is an insect bite. Those are very common, and a lot of times you're treating symptomatically and trying to prevent infection. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day